5 things about carpal tunnel syndrome. Hello, I'm Sanjay Miranda, hand and upper limb surgeon, to discuss 5 things about carpal tunnel syndrome today. Firstly, number 1, what is carpal tunnel syndrome? Carpal tunnel syndrome is an entrapment of the nerve in this location. This is the area known as the carpal tunnel. On this side it's bone, and this side there is a ligament forming a tunnel. Through that tunnel travel the tendons that move the fingers, but also the nerve that gives feeling to thumb, index, middle, and half of the ring finger. This nerve is called the median nerve. Number 2, why does carpal tunnel syndrome happen? In most cases, there is not a specific reason, but it's a combination of the natural structure of your wrist, how tight and slim your wrist is, versus the loads that you're putting against it. Like any structure in the body, when we apply repeated loads, like as weight training, we build muscle. But equally, the tendons also become thicker, and the lining of the tendon may also become thicker with this repeated use. This tunnel, the carpal tunnel, does not stretch. Therefore, as the tendons become thicker, the nerve becomes compressed within the carpal tunnel. Other causes that can happen, a broken wrist can cause swelling and bleeding within, and therefore cause pressure on the median nerve. Conditions which cause inflammation of the lining of the tendon. Conditions which cause fluid retention, such as during pregnancy. Carpal tunnel syndrome is quite a common condition during pregnancy. But in the majority of cases, we don't really know why it happens. There are also conditions which make people's nerves susceptible to becoming compressed. This is an uncommon genetic condition. Number 3, what are the symptoms of carpal tunnel syndrome? Typically, people describe tingling affecting the fingers. In the textbook case, the small finger is not involved, but quite frequently I see in the clinic people complaining of the tingling in the finger. But generally speaking, the textbook is thumb, and these 3 fingers become tingly and numb. Numbness. Numbness may come and go, but in severe cases, the numbness may be permanent in these fingers. And this is very difficult because the thumb, index, middle finger are for fine activities, such as doing buttons or zips or picking up coins or fine objects. Early symptoms can be where someone frequently finds they're dropping objects. They think they've got a hold of something, but it drops. Quite frequently, the symptoms are troublesome at nighttime, where one is woken up with tingling and numbness in the hand, disturbing the sleep. People describe many ways to try and relieve the symptoms: hanging the hand down, shaking the hand, running under cold water. But whatever it is, it's a very disturbing symptom. In the very worst cases, this muscle, which is quite a fleshy, thickened muscle, can become very flattened and wasted. Weakness of movement of the thumb and some weakness with pinch grip. These are late symptoms, getting weakness and muscle wasted. Number 4, how is carpal tunnel syndrome diagnosed? In the majority of cases, it's the history provided by the patient and diagnosed by the doctor or physiotherapist seeing the patient. But in some cases where there is some uncertainty or we want to gauge the severity of the condition, we use examination or investigation called nerve conduction studies. I'll be doing a separate video talking about this, but in essence, this is an electrical nerve test, testing the function of the nerve in terms of the feeling nerves and in terms of the movement of motor nerve. Ultrasound scan can also be used to demonstrate compression of the nerve. This is not a frequently used method. Number 5, what are the treatments of carpal tunnel syndrome? Firstly, non-invasive treatments. This can involve exercises. I'll be uploading a detailed video showing these exercises which you can follow. So subscribe and pick up the update on this. One can also use splints, which is a device to place on the front of the hand to stop the wrist bending at night time, because this posture places stress on the median nerve within the carpal tunnel. This is used generally at night time. The splints are not comfortable during the daytime and also interfere with activities. Invasive treatments to begin with. Steroid injections can also be done if the splinting and exercise does not help. Steroid injections are not painful if done correctly. They can give a couple of days of increased pain and aching within the wrist. However, can be effective within about a week or so of the injection. The research shows that the majority of steroid injections do wear off within 12 months of being given. In the small cases where someone has a reversible condition such as untreated underactive thyroid, the steroid injections can temporarily ease symptoms while the thyroid function comes under control with medication. The other condition commonly where steroid injections are used is during pregnancy, where symptoms are not controlled by splints, and we know that once a child has been delivered, the symptoms often settle. But during that time when the mother is troubled with these symptoms, steroid injections can be given in the third trimester with discussion about the risks and benefits to help with the symptoms. Of course, finally, surgery is the other way of treating this. If all the other methods of non-invasive and steroid injections have not worked. Surgery is a very effective technique. It has been around for nearly 100 years and is usually a very simple operation done under local anesthetic. This will involve an incision in this location about 3/4 of an inch long. I'll be discussing the aftercare in a separate video, so keep following this channel. So carpal tunnel surgery is normally done within about 30 to 40 minutes under local anesthetic. It's day surgery, and most people take about 4 to 6 weeks to fully recover from the surgery, depending, of course, what their occupation, hobbies, and interests are. Thank you. I hope this has been helpful. Keep following this channel for further information.